Researchers from the University of Georgia have found that the United States ranks first among developed nations in rates of both teenage pregnancy and sexually transmitted diseases. In a 2014 study by the Centers for Disease Control, it was found that young people aged 15 to 24 acquire half of the nearly 20 million new STDs. Most, if not all of us, have had varying degrees of sexual education instruction, and so our experiences with this topic might be a little bit different. This public health issue is important to address if we want to ensure that future generations have the necessary skills, tools, and medically accurate information to make informed decisions when it comes to all aspects of health. I'm very passionate about public health, which is why I chose to delve into this topic. And today I will explore what comprehensive sexual education is and why it is the best for our society. And I will do this by covering our current sexual education programs, and I will explain why comprehensive sexual education is the best once it has been implemented. First, I will explain what our current sexual education programs are, and in the United States we have 3 programs: abstinence only, abstinence plus, and comprehensive. And according to the National Conference of State Legislatures, each state can make its own policy regarding sexual education, so the policies do vary by state. And in a report by the Guttmacher Institute as of September 1st, 2016, only 22 states mandate that sex and HIV education is taught in public schools, and of those 22 states, 18 mandate that contraception is covered, and only 13 require that the information provided is medically accurate. So the first type of program is abstinence only, and according to Advocates for Youth, these programs are shame-based, inaccurate, ineffective, and they may also be harmful. So in these programs, abstinence until heterosexual marriage is reported as the only moral choice for young people. These programs are also gender discriminatory, and contraception is only mentioned in terms of its failure rates. And in this program, it has also been found to contain false information. According to the Guttmacher Institute, 1 out of 4 U.S. teens receives abstinence-only education. And this explains why so many teens lack information about contraception, which also explains the positive correlation between states with abstinence-only programs and having an increase in teenage pregnancy. As you can see in this chart by the Guttmacher Institute, in the southern United States, they have the highest percentage of abstinence-only education programs. And in this map by the CDC, you can see that these states in the South, which have the highest percentage of abstinence-only programs, also have the highest teen pregnancy rates. The next type of program is abstinence plus, and this program takes some of the ideas from the abstinence-only program, but it also provides information about contraception. However, the information is in the context of a strong abstinence message. Now, the last type of program is comprehensive, and according to the Sexuality Information and Education Council of the United States, or SECUS, this holistic program gives young people the tools to build healthy relationships. It stresses the value of abstinence while also preparing young people for when they do become sexually active. This program provides medically accurate information regarding the benefits and side effects of all types of contraceptives, and this program teaches the skills of how to make responsible decisions about sexuality, including how to avoid unwanted advances, unwanted verbal, physical, and sexual advances. And lastly, this program teaches how alcohol and drugs can affect responsible decision making. So what are the effects once we implement comprehensive sex ed? The University of Seattle found that those who had received comprehensive sexual education were 60% less likely to get pregnant or to get someone else pregnant. And SECUS did a study in 2007 where they took 80 schools who had implemented this program, and they found that many teens delayed or reduced sexual activity, they reduced the number of sexual partners, and they also increased condom or other contraception usage. And this program also worked for all youth populations regardless of gender, ethnicity, location, or sexual experience. But despite all the research and evidence supporting comprehensive sex ed, it is estimated by the Guttmacher Institute that only 5% of U.S. teens receive this type of education. To conclude, today you've learned about the different types of sexual education programs in the United States, abstinence only, abstinence plus, and comprehensive, and you've seen why comprehensive sexual education is the best. We should respect our youth enough to provide them with honest, scientifically accurate, and age-appropriate information. I was fortunate enough to attend a high school where I received fairly adequate sexual education instruction, but I know that a lot of kids aren't that lucky. And it is my hope that every student who goes through our public schools can exceed that level of education with a comprehensive sexual education program.